Carmel Angelo, Mendocino County CEO, and we're here today for our weekly update on our COVID-19 event. Today, we have Dr. Doohan with us, and she will be talking about the revised shelter-in-place order and also the facial covering order and the latest events that have occurred. Additionally, along with Dr. Doohan, we have Jim Russ with us, and he is the Round Valley Indian Health Center Executive Director and also the Round Valley Tribal Center President. So at this time, we'll go to Dr. Doohan. Thank you.
Greetings, Mendocino County. I want to congratulate all of us for continuing to work so hard together to keep our community safe through sheltering in place, through social distancing, through wearing facial covering. We're going to be speaking today in particular about a very strong and good partnership that we have with Round Valley Indian Tribal Council and Round Valley Indian Health Center, where we are continuing to work to keep our communities safe and our people well. So let me start out by talking about two new orders that came out today that are going to continue to help us have protection against the COVID-19 pandemic. The first one is the fourth version of our sheltering in place order. It comes out today and it goes into effect today. And this sheltering in place order is meant to just give a bit of freedoms so that we can continue to keep sheltering in place intact until early May, when we are anticipating limited reopening. So in the new sheltering in place order, which is up online on the Mendocino County website, and there's a red line version there as well, so you can easily see the changes. One change is that if you want to recreate, you can drive 20 miles from your house and start your recreation there. So in the original order, the version 3 order, we said that if you're going to recreate, you needed to take off by foot or bicycle from your own house, or go the shortest distance possible to safely recreate. Now it says in the sheltering in place order that it's permissible to drive 20 miles in order to initiate your recreation. This is because we know the weather is becoming beautiful, and we really want people to safely be able to recreate outside within our county, residents of our county, close to their homes. And this is recognizing that many people live rurally, and it may be difficult to take off from their residence and be able to recreate right from where they're living rurally. And the other change to the sheltering in place order is that in the previous order, I had allowed live streaming of events as being a permissible gathering. You know, the governor's order that led us into sheltering in place does not allow gatherings. So in the last sheltering in place order, I allowed gatherings, and I said of 4 people to participate in live streaming events so that we can improve the quality of life of the people of our county by allowing them to participate in events through live streaming. In that last order, I said because of the dangers of singing that we've seen due to a chorus in Washington State where the people practiced social distancing and they weren't sick, they washed their hands and they had a choral practice, but nonetheless, over 40 people got sick and 2 people died in that chorus. So because of that, I was very concerned about singing and how that might be putting the people participating in the live stream in person at risk. And so what I've done is that I have, in this new sheltering in place orders, I just do not restrict singing in these live stream events. But what I do is I say that there must be caution given if singing is performed in the live stream event so that other people in the room do not become exposed. And that protection could be, for example, standing behind a plexiglass screen when singing. The other thing that is not changed in the order, but I want to just clarify that when non-essential businesses have inventory that they would like to sell, it is allowed for that to be done by delivery, and that delivery could be by employees of the business actually delivering the items to an individual's home who've purchased it. The other change this week is to the facial covering guidance is becoming a facial covering order. And that order was released today, but it does not come into effect for another week. And the facial covering in order for the public is where you can wear a simple homemade facial covering. It could be an old t-shirt that's clean, it could be a bandana, or it could be something that's sewn. But the idea is that it covers the nose and mouth. And if a person is in the infectious period of COVID-19, where they aren't feeling sick yet, but they are still able to pass the infection on, wearing this facial covering will protect others from getting sick. So facial covering orders have become widespread across California, and they're meant to prepare us for limited reopening of the sheltering in place, which will happen in early May. So I'm wanting to give the community time to get their facial coverings in order. In other words, making them or creating them out of cloth that you have or purchasing them. I want the community to have time. That's why it started as a guidance. Now it's becoming an order, and we have a week to comply. The idea is that when we go out into public and we're going to be within 6 feet of other people, and that they would be exposed to the respiratory droplets that come out of our mouth, that we would wear a covering to protect others. The final order that I'm considering, I did not release today, although I have been talking about it in public, and that is an order for masking, medical masking in medical facilities like skilled nursing facilities, hospitals, clinics, and by our first responders. This is something that I'm continuing to work on in collaboration with getting feedback from the medical community, and I hope to have it come out as a guidance, not an order next week. All of these orders that I'm discussing are in collaboration with our community, with leaders in our community, and also with the region, the greater region that we live in of the Bay Area and our rural counties to the north. So we are in alignment with our region. The other thing that I want to share today is my great gratitude for the Round Valley Indian Health Center and the Round Valley Indian Tribal Council for the excellent way that they have cared for their community in Round Valley. And this is regarding that we have an announcement yesterday that there were 3 individuals from the same family, from the same household, that were diagnosed as having COVID-19. And this morning we got additional information that 2 more members of that household have also tested positive for COVID-19. This testing was done in an excellent fashion by the Round Valley Indian Health Center. They have received a machine now that can test right there in that clinic. The clinic practitioners wore proper PPE and took excellent care of the people in their community. The individuals, these 5 members of the family who are within household are isolating in that home. They're doing well. None of them are requiring hospital attention at this time because they are doing well. And our public health nurses are actively carrying out the contact investigation. That is what we do when we have new cases, to learn about who this family might have been in contact with and to make sure that those people have not become sick and to make sure that they are in quarantine and so on. So I do want to express my gratitude as well to the Round Valley Indian Tribal Council for helping us in public health to collaborate and respond to the COVID-19 pandemic by working together to make sure that our community is safe. And with that, I think I would like to say thank you, Mendocino, for continuing to do everything you can to keep our community and ourselves well. And in early May, we will be working towards limited reopening, which means that there will be some relaxation of the sheltering in place aligned with the governor, assuming that he also takes these steps and aligned also with the greater Bay Area. For that effort, I'm working with our elected officials, with our community leaders, to make sure that we consider the options for how we might do limited reopening. And in those options, we need to be sure that we keep our communities safe by limiting transmission, supporting social distancing, and making sure that those people who are most vulnerable are kept safe. So thank you very much.
Russ, excuse me, who is the Round Valley Tribal Council President. Mr. Russ?
I guess, am I good to go?
I'm waiting for our PIO, Sarah Duquette, but I think that would be fine. Why don't you go ahead? Thank you.
Okay, sorry about that. Good afternoon. My name is James Russ. I'm the Executive Director of the Round Valley Indian Health Center, and I'm also on the Tribal Council at this present time. I'm the President of the Council. And I would just like to mention that with the advent of the coronavirus, the COVID-19 pandemic, the Round Valley Tribal Council took this news very seriously from the very beginning, and especially at the Tribal Health Center. And so we've been following all the steps that are coming down, all the orders that are coming down from public health, and from our local public health, from our state health department, from our IHS, the Indian Health Service, and also from the CDCs. So we've been encouraging our people to shelter in place, and we've released some of our most vulnerable people that are in our paid positions to their homes to shelter in place. We've been encouraging our community members to only go out for essential services, and the whole 9 yards that I think most of our public has been hearing over the past couple months. We took it very seriously at the Tribal Council level, and on March 18th, we declared a state of emergency just to reinforce these orders, and also to that are coming down to us, and also to really look out for the safety and the protection of our community members, especially our most vulnerable, our elders and our youngsters. So we did take it very seriously, and we have been following to the T all of the orders that are coming down. Like I said, especially at our health center, where we've been wearing the masks, the gloves, the gowns, all that stuff to protect our staff. And we've been doing the screenings out at the front of our health center. And our main goal with that was to keep our health center from not becoming contaminated, and so that we could continue to provide services and be open for services on behalf of the community. So I just can't really emphasize enough that we've been following these orders, and we're trying to relay that to our community, that we need to follow this shelter in place and to stay at home. And I know it may be a very inconvenient. I've already heard the rumblings that everybody's going stir crazy with cabin fever, and I understand that. But I would like to thank those that have adhered to that, and we really appreciate it, because I think in Mendocino County as a whole, we only had, I believe, 5 positive tests prior to yesterday. And so I think that speaks for itself. Our community has been, for the most part, staying at home. Unfortunately, this happened yesterday where we have these positive tests. So now we're working very closely with the public health department and other resources that they've brought in. And I'd like to thank them for their efforts and their really quick efforts, that we are working together, and we're going to continue to work together through this whole crisis situation here. But I'd like to thank again the public health department and all the other players. I'm not sure of all the players involved, but I'd really like to extend that gratitude out there, that they were Johnny on the spot with supplies, equipment, and also their expertise. So with that, that's about all I have to say about that at this time. So with that, I'll turn it back over. Thank you.
At this time, I would just like to remind the public that we do have...
I'm not sure what happened with our PIO, Sarah Duquette, but I think that is the end of our live stream today. So I'll wrap it up by saying thank you, and we can log out, I think.
Mendocino County
Thank you,
CEO.
Dr. Doohan.
Before we go offline, I would like to remind the public that we do have a call center that is open, and the number for the call center is 707-234-6052. We also have what's called a warm line, and a warm line is a non-crisis support line that is operated by our behavioral health department, and anyone could call that number 7 days a week from 8 a.m. to 6 p.m., and that number is 707-472-2311. Again, thank you, have a good day, stay safe.